It's 2:02 p.m. on Saturday, the 17th of March, 2012. I'm Mark Strassman, reporter with Ethiopia News. I'm about to talk to Ken Pinkerton, who's a professor of pediatrics at the UC Davis School of Medicine and director of the UC Davis Center for Health and the Environment. He's going to talk to us about a report about pulmonary health and the changing environment. Welcome to Ethiopia News.
Thank you very much.
We're going to talk about the findings and recommendations of a report issued this week by the American Thoracic Society. Tell us about this group and its mission.
We had the opportunity to have a one-day workshop at the meeting for the American Thoracic Society. And our workshop theme was on climate change and respiratory health. This was an opportunity for us to bring together leaders from around the world who were expert in pulmonary medicine, scientists, climatologists, simply to talk about if climate change is a real problem, what would be the implications on respiratory health.
When and where was this conference held?
This conference was held in New Orleans in May of 2010.
Okay. Go ahead, and what did you want to do then?
Well, we really felt over the past few years that it was really important for us to better understand what the potential implications of climate change may be on patients who have respiratory or cardiovascular problems. And so this workshop was really to come together for us to better understand if there were implications, what those implications might be for patients. And so we met together and really had a great experience. It was to really discuss where there might be research gaps, where there are research needs, what are the needs for education or for better infrastructure to address issues of respiratory health based on climate change.
Were there any disagreements as to whether or not climate change was a reality?
Well, because the majority of us are scientists, not in climatology, as well as respiratory physicians, we weren't really arguing that particular question. What we simply felt would be the basis for our discussion is that if climate change does exist, how does it impact on the respiratory health of patients?
Okay. What kind of climatic and environmental changes stemming from climate change did you focus on as having the biggest impact on public health?
Well, our greatest concern is air quality. And so we really discussed a lot some of the issues that might be surrounding air quality and climate change. And so one of the issues that we really came to understand much better is the fact that the formation of ozone is very much connected with climate change, as well as the effects of having greater numbers and concentrations of particles in the air. Particle concentration based on climate change is very much associated with increases in temperature, with the increased number of wildfires that we are experiencing, especially in California. In the summer of 2008, we had over 1,000 wildfires that were burning within the Central Valley of the state of California, which led to some very significant air quality problems with regard to airborne particles. We've also found that some of our investigators and some of our scientists from Africa, as well as from Turkey, discussed increasing desertification of regions within their countries or within the continent that is also creating problems with increased amounts of dust present in the atmosphere.
Okay, so given those problems, what are the respiratory effects that are bound to happen, and what are some of the direct and indirect effects of climate change on public health?
What we found is that the increased concentration of ozone and airborne particles within our atmosphere have a direct effect on the exacerbation of asthma, as well as more adverse effects for people who have a pulmonary condition referred to as pulmonary chronic airway obstruction, or COPD. Also, individuals who may be very sensitive to pollens, we are finding that climate change is changing the pollen season. It is becoming longer. In some instances, it's becoming more intense, which then leads to problems with asthmatic responses as well as allergic responses of individuals who are sensitive to these kind of conditions in the air.
What areas of the world are most likely to be affected by climate change as having an impact on pulmonary health?
We have really felt that it is a global issue. It is not centered in any one single country. We have found that that these issues, as I've mentioned, are very prevalent within the state of California with increasing wildfires. We've also seen in the southeast the increasing moles and pollens that have led to a greater or longer bloom season, which is also associated with greater incidence of asthma, or at least the ability for people who have asthmatic-like conditions to be affected by these seasonal changes. We've also seen that there are changes in Europe. One of the concerns that was brought out is that vector-borne diseases that typically have been seen only in the Mediterranean environments in Europe have now are now being seen as far north as the Scandinavian countries. And one point was also brought up that some of the issues of molds and fungi that were usually only within Central America or Mexico are now seen as far north as Vancouver, British Columbia.
Now, as a general proposition, are you more focused on adaptation or mitigation? Are you designing your programs to deal with these problems, or are you trying to do something about the causes?
We're trying to do both. One of the major concerns that we have is just simply some of the issues that are associated with biomass burning. Almost half the world prepares their fuel using biofuels. In other words, burning of wood or other materials that lead to the generation of black carbon. And we found that black carbon is actually quite a significant factor in increasing climate change, just simply due to the fact that it reflects many of the rays from the sun well, actually, even more importantly, I guess it keeps in some of the heat towards the Earth's surface. But in terms of adaptation, we feel as though, and maybe mitigation as well, that is really critical that we have greater educational efforts that are directed towards helping patients and especially helping physicians to talk to their clients, talk to their patients about what they should do. Should we have a heat wave, or should there be a change in air quality, what they can do to better protect themselves from such events.
So you want the doctors and the patients to be ready?
That's correct.
Okay. Could you say something about the comparison of costs between mitigation and adaptation, and how much it's going to cost the public because of these increased health risks compared to what it would cost to do something about the causes?
Well, I really do think that there are, many plans that are out there to try to mitigate these problems. Certainly, the carbon dioxide emissions is one approach, but one of the areas that we felt would be very critical to help in mitigation would be simply to take a greater effort on the Clean Stove Initiative that now exists in many different countries, but especially in Asia, and in the Middle East, that these approaches could actually help to reduce black carbon emissions, which would be a significant improvement in terms of changes that are associated with this increasing temperature, but more importantly with just simply better air quality indoors.
I'm reading a book called Abundance that talks about the advisability of getting electricity to poor people and letting them use electric stoves that would allow them not to have to use these biofuels that cause these carbon problems.
Yes, and I think that is a good idea. I think one of the issues that we really need to think about very seriously are low-resource countries. They just simply don't have a lot available to them. And so the Clean Stove Initiative, and there are a few that are ongoing, are designed to provide for the use of stoves that would be economical, perhaps only $30 to $50 in cost, and that would be something that could be sustained for a period of 3 to 5 years. I think the real solution here is, again, an educational process to have people realize that these stoves that can be provided would be an advantage over biomass fuel burning.
Okay, let's sort of wrap up by talking about what you're doing to get your message out there to the public and to policymakers. What kind of outreach have you undertaken to do that?
Well, our effort is simply to prepare this workshop document, which has been approved by the board of directors of the American Thoracic Society, that allowed us to publish this in the proceedings of the American Thoracic Society. This is a first step in which we have provided 27 recommendations that deal with important gaps in our research, with the need to deal with education, with cooperation among countries, and with better approaches of simply talking to one another. We've realized that as scientists and physicians in pulmonary medicine, that there are so many different problems that are associated with climate change, air quality, and public health, that we really need to have interactions with engineers, with social scientists, with stakeholders, and have a discussion that's going on. I think we also need to make aware the importance of international organizations that have existing infrastructure, that they consider that climate change is an issue that is important for them to also incorporate into their programs, their existing programs, to improve public health.
Okay. Before we go, tell us a little bit about the UC Davis Center for Health and the Environment, what it does, what you do there.
Our center is based at the University of California, Davis. The Center for Health and the Environment is a collection of scientists and graduate students who are very much interested in environmental issues as well as health issues. So we have tried at the Center for Health and the Environment to bring together scientists of different disciplines to address questions that directly impact on the environment as well as improve public health.
Okay, and finally, what can people who are concerned about these findings do in their local communities and political jurisdictions to deal with the health effects and their climate change related causes?
Well, I really think that it's important for us to be aware of the climate, be aware of weather conditions, that we may be able to form a network, whether it be by our cell phones or by Twitter or Facebook or whatever it may be, to help each other really be aware of potential issues related to weather and to air quality, so that we might be able to share that and actually have almost like an alert network of issues that may be going on, so that we can inform each other better.
Okay, good. You've helped inform everyone better here today on Utopia News, and I want to thank you for your work and for talking to us today.
Thank you very much.